Welcome to Module 1, Lesson 5. In the last lesson, you explored why medical interpreters matter, how your work affects patient safety, ethics, equity, and even legal compliance. Now that you understand the importance of the role, this lesson will focus on what that role actually is, what you are responsible for, what you are not responsible for, and how to stay within those boundaries under pressure. By the end of this lesson, you'll have a clear picture of the medical interpreter's role as a communication bridge, and you'll see how accuracy, completeness, impartiality, and professionalism guide your behavior in every encounter. The role of the medical interpreter is specific and limited by design. Those limits are not about distrust or lack of skill. They exist to protect patient safety and communication integrity. This means that interpreter is a communication bridge, not decision maker. At its core, your role is to facilitate spoken or signed communication between people who do not share a common language, without becoming a participant in the interaction. The provider speaks to the patient, not to you. The patient speaks to the provider, not to you. You make sure each message is fully understood in the other language, which is the target language. When this flow is respected, communication feels natural and balanced. You are present, but you do not redirect the conversation. Now let's break down the core responsibilities that define how you carry out this role. The first core responsibility we're going to look at is accuracy. Accuracy means conveying exact meaning, not a nicer version, not a simplified version, and not your interpretation of what they meant to say. This accuracy includes medical terminology, emotional content, hesitations and repetitions. Accuracy applies equally to both parties. The patient's words and the provider's words deserve the same precision. The second core responsibility is completeness. Completeness means interpreting everything that is said. Nothing may be omitted even if it is. A side comment. Emotional expression, non-medical detail, repetitive or uncomfortable. You do not decide what is relevant. That decision belongs to the provider and the patient, not to you. Third core responsibility is impartiality. Impartiality means you remain neutral and unbiased. You do not take sides or allow your beliefs to affect the message. Impartiality does not mean you lack empathy. It means your empathy is shown through faithful interpreting, not through advice, reassurance, or personal commentary. The fourth core responsibility is confidentiality. As an interpreter, you are entrusted with highly sensitive information. Confidentiality equal. What is said in the encounter stays in the encounter. Confidentiality continues even after the assignment ends. Sharing patient information outside authorized professional settings violates both ethical and legal standards. Now that you understand your core responsibilities, let's talk about how to stay in role when things get emotionally or not ethically difficult. How do you stay in role during complex interactions? Healthcare encounters are often intense. You may interpret bad news, strong emotions, cultural misunderstandings, ethical tension, urgent decisions. In those moments, you might feel pressure from the patient, the provider, or your own emotions to step outside your role. But what makes you a professional interpreter is the ability to stay in role even when it feels hard. This is what we call professional discipline. Staying in role in this situation means interpreting emotional content without reacting, conveying difficult information without softening it, allowing silence or tension to exist if it is part of the interaction. To understand staying in role, it also helps to be clear about what is not part of your role. The role boundaries in the context means what the interpreter do not do. Interpreters do not explain medical concepts on their own, provide health advice, answer questions on behalf of others, influence decisions, offer reassurance or personal opinions. If a patient turns to you and asks a question, your job is to interpret that question to the provider, not to answer it yourself. If a provider asks, "Do you think the patient understands?" you may point out language-related signs of confusion, but you do not judge capacity or make clinical statements. You need to know this fact. Staying enrolled doesn't mean you are passive. You still have the right and the responsibility to intervene appropriately. As we've learned earlier, interpreters have the right to intervene appropriately. Being role faithful does not mean remaining silent when communication breaks down. Professional interpreters intervene when needed to protect accuracy and clarity. Appropriate interventions include 1. Requesting repetition or clarification. 2. Managing turn-taking. 3. Asking speakers to pause. 4. Alerting parties to possible misunderstandings. These interventions should always be brief, transparent, and followed by a return to interpreting. You step in just long enough to repair the communication, then you step back into your conduit role. Let's look at a common situation that tests your ability to stay in role. Professional presence is essential. Professional presence is how you present yourself, verbally, visually, and behaviorally. Professional presence includes appropriate attire, calm demeanor, respectful communication, thoughtful positioning in the room. You should position yourself so the provider and patient can see and speak to each other directly while you remain accessible. Your presence should support the interaction, not dominate it. Of course, working in these settings can be emotionally demanding. Let's address that reality honestly. Not every challenge in medical interpreting is linguistic. Some are deeply human. Medical interpreters are exposed to illness, trauma, and sometimes end-of-life conversations. It's normal to feel emotional impact, but emotional processing must happen outside the interpreted encounter, not during it. Healthy strategies to overcome this challenge include emotional self-regulation, debriefing appropriately, seeking peer or professional support. Maintaining emotional boundaries protects both you and the integrity of the interaction. You can care deeply and still remain neutral. Let's finish by talking about accountability, what it means to own your practice as a professional. Interpreters are accountable not only for what they interpret, but for how they perform in every encounter. Professional integrity is demonstrated through consistent, deliberate practice. It means you follow ethical standards, ask for clarification when needed, continue learning and improving, recognize when an assignment is beyond your skill level. Sometimes integrity means saying no, declining work in a language or specialty you're not prepared to handle. That protects the patient, the provider, and your own professional reputation. Lesson 5 completed. In this lesson, you learn that the role of the medical interpreter is clear, disciplined, and essential. You are a communication bridge, not a decision maker, advisor, or advocate. By maintaining accuracy, completeness, impartiality, confidentiality, and professional presence, you support safe, ethical, and effective healthcare. With this role clearly defined, you're ready to tackle one of the most challenging topics, understanding the difference between scope of practice and advocacy, and how to stay firmly within your lane while still supporting language access.